Dear students, Assalamu alaikum. Welcome to this series of lectures which will be posted on the webinar jam, and you can study it from there and then we can discuss this later. So I hope you are having safety measures at home and you are protecting yourself against this pandemic. We all need to be taking precautions and spread the message of hand washing, social distancing, and staying at home. So today's topic of discussion is surgical anatomy of liver. It is mainly the repetition. You have done this in your anatomy lectures, and as you know that liver is the largest organ in the body. So in a 70 kg man, it weighs about 1.5 kg. It is the largest solid organ in the body. Otherwise, the largest organ in the body is, skin. And liver parenchyma is covered by the capsule. It is covered by the visceral peritoneum, except posteriorly, which is known as the bare area of the liver. And you know that anatomically, it is divided into a right lobe and the left lobe. And these lobes are separated by the falciform ligament. The larger lobe is on the right side and the smaller lobe is on the left side. So surgically, if we resect there is a procedure which is known as the Pringles maneuver. In case of severe bleeding, in case of trauma, the non-crushing clamp can be applied to the free border of the lesser omentum, in which the hepatic artery, portal vein, and the common bile duct are present, and that clamp can be safely applied for a period of 30 minutes. So this maneuver is very effective in temporarily reducing the bleeding from the liver. So there can be variation in the blood supply of the liver. The right hepatic artery, it is commonly a branch of the common hepatic artery, but sometimes it can arise from the superior mesenteric artery directly. Similarly, the left hepatic artery has its own variations. It can sometimes arise from the celiac trunk, from the left gastric branch as well. So remember that this area has a lot of variations. Especially the extrahepatic biliary passages, that is born with anomalies. So there are more variations of the cystic duct, the common hepatic duct, and the common bile duct. Similarly, there is a lot of variation in the arterial supply of the liver. So it is more important that once a major surgery is performed in this area, like liver resections, one should be knowing that which vessel is rising from which main artery. So if we see the structures at the hilum of the liver, there is a hepatic artery, portal vein, and the bile duct, and they are present within the free border of the lesser omentum, or the other name of the lesser omentum is the hepatoduodenal ligament. So to the left of this line, functionally it is the left lobe of the liver which is supplied by the left branch of the hepatic artery and left portal vein and drains into the left hepatic duct. I hope this functional division of the lobe is clear to you. If there are any questions, you can always ask through the webinar. And then histologically, liver has lobules and it has plates of liver cells separated by the hepatic sinusoids. And again, there are these tiny radicals of the portal vein, hepatic artery, and the bile duct, and ultimately it drains into the hepatic veins. So I think we will discuss the investigations in our next segment. That's all for this talk. Please ask any questions regarding to this discussion, and we can always do an interactive session in the webinar. Thank you.